So I remember growing up, my parents and people around will always tell me to throw my fallen teeth above the roof if I want a new one to erupt. Teething is a process by which an infant's teeth erupts. This over the years has been associated with symptoms that can be very difficult for the infant and very confusing for the parents. Welcome back to my YouTube channel. My name is Joy. I'm a registered pediatric nurse. On today's episode, we'll be talking about teething disease, how to avoid illness during teething, what to expect in a teething infant. We'll also be addressing myths that have been attached generationally to this teething and what to do when you have a teething infant. Some children generally teeth without showing any symptom. You just see the tooth erupt below the gum, while in some other children, they come down with gum swelling, itching sensation, soreness, irritability. You see your baby crying so often. Their temperature is sometimes elevated and they drool a lot of saliva. So I remember growing up, my parents and people around will always tell me to throw my fallen teeth above the roof if I want a new one to erupt. And this is just one of the many myths generationally attached to teething. And that brings us to myth number one. Teething causes fever, diarrhea, and general body infection. To clear myth number one, teething do not cause fever. Fever is due to infection and other causes. So using the normal temperature range, which is 36.5 to 37.5, it has been found that teething do not cause less than 1 degree elevation in the body temperature. This implies that using the normal temperature range, which is 36.5 to 37.5, your baby's temperature during teething shouldn't be more than 37.6. And anything above this is a sign of infection. And talking about diarrhea and other general body infection, you agree with me that between the age of 6 to 8 months, babies start to crawl and they are more active. And coupled with the gum itching sensation, they tend to pick everything they see in the environment into their mouth. Because their immune system is just building up at this stage, they are more prone to infection. And when this infection happens, symptoms like runny nose, high fever, convulsion, diarrhea, vomiting, and even loss of weight sets in. So one sign your baby is teething is that they tend to chew on their fingers, their toys, and virtually everything they can lay their hands on. And this is a major source of infection. So it is important to ensure that their play space is clean, it is neat, and even their play materials, that is their toy, is regularly washed, and make sure to wash their hands as often as possible. And for children above 6 months of age, you can give them soft fruits or even vegetables to chew on. You can also provide comfort by playing with your baby. This helps to distract them from any pain they might be feeling in their gum. You can also gently rub their gum with your finger. Make sure your finger is clean in order not to infect the baby. Teething makes some baby restless and more active, and this tends to increase their body temperature and can lead to rash. So it is important to always wipe their face of this heat, and you can also watch our video on rash prevention. Link to the video is attached to the description below. You can also use pain relief like paracetamol. Ensure to use the right dosage for your child's weight, and you can always contact your healthcare practitioner if you are confused of the dose to use. Teething rings also provide a chewing means for your baby. It's important to avoid the ones that has liquid inside of them, and ensure to wash these teething rings as often as possible because they can be a source of infection. And do not for any reason tie this ring around the neck of the child might use it to strangle himself. For this teething ring to provide maximum comfort for your child, it is advisable to chill it in the refrigerator, not freezer, before use. During teething, you should avoid sugary foods. This tends to damage the teeth. And also ensure to use age-appropriate brush and toothpaste. So before we wrap up, there are some harmful teething practices that I would like to talk on. And number one of it is placing aspirin against your baby's tooth. This has been found to cause Ray's syndrome. And I'm sure you don't want your baby looking like what you're seeing on the screen right now. And medically, aspirin is not used on children below 20 years of age. Another harmful teething practice is rubbing alcohol on your baby's gum. This has been found to cause intestinal upsets and even organ damage. So I've also seen some mothers use teething gel. Some teething gels contain substances that are not safe for your baby's consumption, and they have also been found to cause throat numbness and even difficulty in swallowing in some babies. Another harmful teething practice is blaming teething for everything, blaming teething for the fever your child is having, blaming teething for the excessive cry. This can lead to delay in diagnosis. Remember I said earlier in this video that teething do not cause temperature elevation more than 1 degree. So if your baby's temperature is more than 37.6, it is a sign that the child has an infection and needs the attention of the doctor. So you should talk to your doctor if your child has visible sign of teeth decay. You should talk to your doctor if your child is above 18 months and there's no sign of teething. You should talk to your doctor if your child has double row of teeth or any birth defects involving the jaw or the mouth. Thanks again for watching. Don't forget to subscribe, share, and like this video. See you again next time.